Hi, everyone. Welcome to the Familywood Podcast. My name is Ross from Familywood. It's a pleasure to have today's guest. Thank you very much for joining us. Joel Hughes, the clinical director from Edgewood Nanaimo, part of the EHN network. Hey, Joel, welcome to the podcast and thanks for coming on.
Morning. Thanks for having me.
Yeah, it's an honor to have you. I'm going to start by just sharing with the audience that now we work together professionally. Joel and I have a history that goes back. As some of you know, I am in recovery myself. And way back in the day when I attended Edgewood Nanaimo, Joel, I think you were the leader of the Cedars group. Yeah. Yeah, Joel, you have tenure at Edgewood. How many years have you been with Edgewood Nanaimo?
This June will be 18 years.
18 years. Yeah. And we often talk with families about that being one of the pieces of Edgewood Nanaimo that's quite unique is the tenure amongst the leadership group, which we'll talk about later. But 18 years, holy smokes. Have you ever counted how many souls you've been a part of their recovery?
Yeah, at one point I kind of looked at it. Turns out that we probably have 450 to sometimes 500 patients that go through in a year. So if you do the math on that times 18 years, it's well over 7,000. I'm not good at math right in my head, but 7,500, 8,000 patients that I've seen go through the building.
It's a lot of souls you've cared for, right?
Yeah.
Vulnerable souls too.
Yeah.
Somebody entering treatment is often in pretty rough shape, right? So you're the clinical director of Edgewood. You are well entrenched in the addiction space. For the audience that's just getting to know you, tell us a little bit about yourself, Joel.
Sure. I grew up where my mother was pretty excited about always helping foster kids. And so we always had a lot of foster kids coming through our home. I think some of my earliest memories are being like 4 years old and holding newborn babies. And just my mom told me they need love, they need to be held, they just need to be taken care of. And so, I'd bawl my eyes out when it was time for those children to leave. And then she'd bring me some more. And so my earliest memories are always recognizing that there were people in the world that weren't receiving some of the care, love, or ideal circumstances that maybe others had. So that ended up slowly translating into, as a teenager, I would bring kids home from school that were maybe struggling with their environment and see if my mom could help. Some I even left behind when I moved away. She still teases me about that. But yeah, then I ended up getting into the field of helping young adolescents that were struggling. And then as I aged to where my energy couldn't keep up with the rigors of adolescence anymore, I switched over to the adults, recognizing that a lot of these children that were in the system or struggling with life probably also had difficult family environments, often at the hands of drugs and alcohol as part of their living situation. And so making that shift to working with adults of all ages and all backgrounds, just hoping that I could make a difference from a different angle, helping people kind of get out of the woods on what was bringing them down. And then, I've heard so many patients say that, hey, like oftentimes when patients come through, maybe they haven't had children yet, or maybe they're estranged from their kids. And to hear stories later that once they enter a life of sobriety, that they start to get those things back, or they now find the love of their life and get married and start having kids. And when alumni come back to a cake night or some kind of alumni event and bring their young family, and they're able to look me in the eye and say, my children have never seen me drunk or high. It's pretty exciting.
Yeah, I'm one of those, buddy.
Nice.
I feel emotional as you share that. Yeah, it's a great sense of pride, and I can see how much pride you have in doing that work and helping them. Wow, you're a mission-based man, eh, Joel?
Yeah, it seems like right from the beginning that became a path I couldn't get off. Yeah.
Yeah, yeah. So tell us about what you do at Edgewood Nanaimo. Yeah, yeah. What's your role there? What's a day in the life of Joel at Edgewood Nanaimo?
Sure. Yeah, I don't always have a complete set schedule. It's not always predictable because I'm the one that people come to when they're like staff and patients, when they're struggling with something, when they're having a difficulty, when they don't quite
Families too.
something. Um, they come and see me or bring a patient to me and say, give us a hand. I like to stay engaged with the patient population. So I lecture every Tuesday morning. I have a series of lectures that I like to work through with patients and get to know them a little bit that way. I still run some of the groups, and I like to stay engaged with patients that are just sort of struggling, not sure why they're there, or maybe not wanting to stay, and just help with conversation and support to see if we can find that inner motivation in a stronger way.
I like that you are motivated to stay engaged with both the clinicians and the patients. I think it's really cool. Good on you, Joel. And okay, so clinical director of how many patients? How many beds at Edgewood Nanaimo?
We have up to 78 beds in our core program, and then we have roughly around 16 beds in our Guardians program. And that's often related directly to PTSD on job related things for first responders, police, fire, ambulance, corrections, active military, and veterans. We also have 16 beds for extended care, which is core patients that maybe just need some more time to get more acclimated into the recovery world, and sometimes just navigating and rearranging their life to make decisions about whether they want to go back to school or change their careers or change their living environment.
I wanted to talk about that today because we're often talking with families about treatment options in Canada. And there's a variety of options in Canada for inpatient services. There's obviously varieties of quality and modalities and things like that. And something that makes Edgewood Nanaimo unique, totally unique in Canada is the extended care programs. I wanted to talk to you about that today because we're often asked about that. Like, what does that mean? Um, so yeah, okay, that's a lot of patience.
It's kind of when we look back in our history at Edgewood, we didn't always have an extended care program, but it was our alumni when we. That's one of the big things is like staying connected with alumni, having an alumni association, working with alumni, having them come back to the building, having them come and do check-ins, and then oftentimes when we're kind of doing our quality improvement kinds of things, we do surveys and we ask lots of questions and we start to gather some information. And it was the alumni that shared with us that some of them believe that treatment was fantastic, but it wasn't quite enough for some of them to
Yeah.
really solidify some of the changes they wanted to make. And so it was really alumni driven to develop the extended care program and to give them a safe environment for a number of months post treatment to really start to practice some of the skills and start to engage in a new lifestyle to help get that muscle memory going of how to do things differently.
I often describe it. I'll talk to the viewers and you about what my experience was at Edgewood Nanaimo because I really want to unpack the extended care program today. We have a lot of people ask about it. So when I'm asked about it, I just share what my experience is. In the space, there's this inpatient model that's a pretty common model, 30, 60, 90 days, whatever. And then all of a sudden, like go home and hopefully engage with some aftercare. What makes the extended care program from my own personal experience some 15 years ago, actually about 15 years ago today, I was maybe leaving right around here. So inpatient, like intense psychiatric support, GP support, like the medical model, right? And getting into structure and some high motivation behavioral changes, some social support starting to engage, but just stabilization really at that point. Is that a fair assessment of like inpatient?
Yeah, and I think what sometimes maybe we forget is that there's not one size fits all. Everyone's coming from a different background. And so if we've had people that, like when you think about the spectrum of mild, moderate, and severe as it relates to the
Yeah. Yeah.
DSM-5 on how the substance use disorders kind of manifest, there are a lot of people that come through that have good jobs, that have family support, that have a lot of love around them and have a decent environment to go home to with
The protective factors are
a
there
lot
for their
of,
sustained recovery
a lot of
after.
protective factors as well as some good recovery capital already present. And those people after 50 days, they kind of have a lot of light bulbs that go on and they realize that they need to just get back to the basics of what they already had. And that's great. Those people probably don't need extended care. They're going to need like the weekly aftercare groups and engagement in the recovery community. But there are quite a few people, especially some of the younger ones, that when we think about that word rehab, um, re means that they've already had some hab. So that's why rehab. um, but some people it's hab. There's no re involved, where some of them are being exposed to these appropriate life skills for the first time. And so we're bringing them out of an environment that has been less than ideal, and they've never yet truly experienced a responsible adult day in their life where they weren't using maladaptive mechanisms right from the out of the gate. So a lot of times it's a new frame of reference. They don't have any frame of reference to understand some of the things that we're discussing or talking about. So we actually have to get them to start practicing it, tripping over it, struggling with it, fighting it in a protective environment where they
Learning skills like money management and
a lot of
socialization and like living in balance, building a supportive community.
and starting to look around and see that the whole world isn't against them. Starting to believe that when your triggers and bells are going off about self-protection, is it's not always accurate, and that there are people out there, there are groups of people out there, there are opportunities out there that don't just manifest the negative core beliefs that they maybe came in with.
I'll share the view for the viewers what my experience isn't generalizable. I'm not that naive, and I'll share my experience with Edgewood. So I did the 2 months of inpatient and like achieved some stabilization at that point, and then I went to the extended care program for 3 months. When I left
And
extended
he needed
care,
it.
what's that?
And he needed it.
Yeah. I was 22, and like
Yeah.
what you described there about like living a responsible, normal life, I had no, no hab at that point. I like that analogy. And so by the time I left the extended care program, I had some money management skills under my belt. Okay. I had already got a new job. Okay. The encouragement was for a humble job that wasn't about making loads of money at that point. So I got a job as a barista at Starbucks. I had already worked, I think, 1 or 2 shifts at Starbucks. So I was like acclimated. I already had transition housing arranged a block away from the center. Like I had my fridge already filled up and like clothes were already moved over. And the day that I left, like I left Edgewood to a house that was already set up. I already knew the people in the house. I already had everything arranged that way. I had my job. I knew my coworkers already. I had, most importantly, and we're going to talk about this today, I had already built my supportive community in Nanaimo, and it was just like a smooth transition off. Plus, I stayed engaged with Edgewood in their aftercare program, weekly, ongoing. There was no blip in anything. And I often attribute my own like sobriety, if you will, to that really stable period, stable transition, knowing how high risk the period is post treatment, right?
Yeah, and I think that's what we often find is 50, 60, even 90 days in a core treatment setting is only just kind of turning on some light bulbs, stabilizing, teaching some coping skills, some stabilization skills, some self-regulation, a lot of the DBT, dialectical behavior therapy things. Um, and yet we often say that core treatment is just the beginning. And the actual marker for whether someone's going to enter long-term sobriety and be successful is the hard work they do afterwards, getting fully engaged in a recovery community, continuing to do the work, continuing to practice the skills. When people walk out of treatment believing they've been fixed or that now they get it and they can just go back to their old life, it doesn't always end very well.
I would like to share the day that I was told I was leaving Edgewood. So like I left it up to the clinicians to just, help guide my exit. The day that I was told I was ready to leave was about 90 days into extended care, and I already had everything, figured out, social, housing, professional. And it was that day I remember I went to the pool in Nanaimo, and I was like really scared to leave. I knew that my exit was coming. The writing was on the wall that it was time to go pretty soon. And I got really scared. And I went back to the center because I was living at the center in the extended care program. And I pulled a counselor aside and talked to that counselor and about how scared I was and about lacking confidence in my ability to stay sober and just how scared. Yeah, her name was Kelly. I don't know if you remember Kelly back in the day. And she said, "Okay, now you're ready. You're humble."
Yeah. Yeah. It's
Yeah.
really interesting when you think of our North American society often really teaches this. We need to either have confidence or fake confidence when really that humility of what's honestly going on for us, having some fear, having some trepidation, having some nerves, having some anxiety is actually good for us, because then we stay curious and we know that asking for help is a strength rather than a weakness, and that we are then more motivated to stay engaged with enough people that have our back when we go a little sideways in our own brains.
Yeah, because we do go sideways, and people in early recovery go sideways, right? Like, so Joel, what's the relapse rate within the first year of departing treatment?
Well, that's a tough one, because it's pretty high, but a relapse doesn't necessarily mean that everything's falling apart. Some people, it's
Lapse.
yeah, it's sometimes it's hard. Sometimes people get to that place and they're pushing too hard, and some enough situations come up that they're sort of that internal units of distress get too high, and they default to that old behavior of just needing a quick fix to get out of that uncomfortable sensations, and they relapse. And so we do have a fair number of alumni that will reach out very quickly and say, uh-oh, this happened to me. I'm not sure what I did wrong. And so we discuss it. We help them get back on track, and then they're able to move forward again.
Cool. I like that. Yeah, I like, and I like that Edgewood also has like a life. You have an 800 number. Is it still? Oh, I might be shooting myself. Is it still lifelong access to phone that 800 number if you're all
Oh, for sure.
messed up
Yeah.
and in
Yeah.
distress?
Yeah. We have alumni sometimes that will call in from 12 or even 20 years ago just to say, hey, I'm struggling. I just needed someone to talk to.
I called in at about 7 years of sobriety. I had just broken up with a girlfriend of 3, 4 years, and these were new feelings for me to process, like grief and all that stuff. Like, that's part of recovery, is learning how to just sit with new feelings. I was quite a mess. I had reached out to all of my social supports and got voicemails like they were busy with their normal lives. And I was so stressed out. I called the 800 number at Edgewood, connected with a support worker that was on staff right then and there, who I knew from was, and we talked it out for 5, 10 minutes. We felt the affect and like moved on.
Yeah. And I think that's one of the things that the general population maybe isn't aware of, or we can't help but sort of what I go through, what my brain does. I can't understand why yours is different. And so sometimes I might miss why a certain trigger for you is, why can't you just do what I would do, kind of thing. Because what we come to understand, like from a science perspective, lots of research has been done. There's way more research that needs to be done in the area of addiction. It's not easily understandable, and there's so many different factors. But one of the things that we've seen is that, I guess what we would call like a high sensitivity, which I really attribute to that there's a certain percentage of the population, whether they're in addiction or not, that is kind of born with a brain that has a dysregulation of the way the neurotransmitters are released compared to maybe 90% of the population. I, I'm not speaking from, like, I'm not reading off a study or know for sure what that is. But what I do know is that the people that end up in our treatment center are probably more reactive, have bigger emotional reactions to similar circumstances than maybe the average person does. And that can be a
Are
gift.
you talking about distress tolerance
Well, it can lead
or
to
like
distress.
affect tolerance
It
in
can lead
itself?
to, yeah, because I think there's a gift in it. I find that a lot of the people that come through the treatment environment, they're more compassionate, they're more intense, they have a stronger intuition, they're more creative, they're deep thinkers, they're fast twitch, problem solvers, compared to a big chunk of the population. Now, under ideal conditions, and if they're loved and embraced for that, that's a gift. What group of 10 wouldn't want at least one person in that group of 10 that is a fast twitch thinker, is intuitive, is like has a high antenna or a sensitive antenna that picks up on things more quickly and can warn the rest of what's going on. But what often happens is that's happening for somebody when they're quite young. And then the people around them see them as overreacting, or being too loud, or being too quiet, or being too angry, or being too, often get accused of being too much of something. Well before,
Too intense.
yeah, well before drugs and alcohol get into the picture. So I often say to the patients that drugs and alcohol were never your problem. They were your solution. And so now that you've come to terms with the fact that drugs and alcohol are actually damaging to your life, maybe we need to take them out. But when we take them out, you're left without a solution. Now you're stuck with the original problem that you were hoping to fix. And so now we're having to do a whole lot of work around understanding how your brain works, understanding that sensitivity, shifting it from a curse to a gift, practicing all of those self-regulation skills, practicing resilience, practicing. I like, for me, some of my favorite DBT, dialectical behavior therapy skills is pausing, checking the evidence, what's really going on, coming to some kind of acceptance that this is my current reality, and then bringing in wise mind. We can often go to emotional mind or logic mind very quickly that we're going to solve the problem or outthink it.
Except,
Yeah. So pausing for a moment and kind of bringing in some wisdom as to like, okay, where might I be a little off track? Where might this be a trigger from something else that I've been through? Where might I be attaching a bunch of meaning to this? We do, I like some of that Brene Brown stuff around like nothing means anything until we decide that it does. And what we find is that highly sensitive people often start attaching stronger, deeper meaning to things very quickly without realizing that maybe that's inaccurate. But
and
if you're fighting saber-toothed tigers as a group of cave people, if you're in a very difficult environment, survival, we need those people. We need people who can like, wow, danger, there's danger, there's danger. But sometimes when there isn't danger, they're also being triggered that there's danger. And then so their emotional reactions are quite a bit higher sometimes than the circumstance truly requires. And so it takes a lot of extra work to prepare yourself, to be grounded, there's a stronger requirement for predictable daily structure and routines. There's a stronger requirement for self-awareness and doing self-work and hanging around other people that are also.
Well, as you were talking, I was thinking about, what's his name? John F. Kelly.
Yes.
Who talks about the strongest predictor of long-term abstinence is the supportive social network that somebody builds around themselves. And in early recovery, would we like to be able to self-assess our cognitions as accurate or not? Yes. And some humility to check in with others and see what their opinions might be tends to be beneficial. Talk about that.
Yeah, I think it's really interesting because if I'm hanging around a group of people that most of them all agree with each other and I'm the odd person out, that can be pretty isolating. That can feel like maybe there's something wrong with me. People maybe start looking at me like I'm the problem. Uh, they, there's some judgment attached to that. And then that really starts to affect someone's self-esteem and worth. But if you're hanging around other people whose brains kind of do the same thing that yours does,
I get you kind of thinking. Yeah.
then they're able to say like, hey, yeah, I get why that was a big deal for you. I get why when you went to the store and those shoes were already sold, you kind of had a meltdown. But because the average human doesn't understand how much obsession, compulsion, and process went into the planning of going to get those shoes. And then when it wasn't there, that emotional reaction is right there. And so it can seem like it's such insignificant stuff that can set somebody off. So you need other people around you that can just breathe with you and right size that and kind of walk you back.
And not judge you for it.
And not judge you for it, not make fun of you, not tease you for how
and not try and fix you for it.
Exactly.
I think about the families that we work with at Familywood, and that's often such a big piece of the work that we do when a loved one enters recovery. So let's say we're working with parents and their daughter is within 4 to 6 weeks of entering recovery. They really struggle to detach from those moments, like the shoe moment.
Yeah. And you know what, as parents, it's not wrong. We would like to believe that, I mean, we take on that responsibility as parents, that it's our job to remove hurdles from our children's lives, to give them best opportunities. And oftentimes we get a little frustrated when they aren't grabbing onto that. And so we use a lot of logic to try and explain something to them. And sometimes we set up boundaries and limits and suggestions, even some bribery, like I'll support you if, I'll do this for you if. But they don't always recognize what's actually happening in that child's brain or that loved one's brain. And that it's different than just being able to, because I think that's why family members of addiction go a little bit batty themselves, is because logic isn't working. When really, I would suggest 80 or 90% of the population, with with enough logic in front of you, you're able to see why your current approach should be adjusted.
I sometimes sit with, because I'm still doing client work at Familywood and will be forever. I love the client work. I sometimes sit with families that are so competent. Like these are like business leaders or like big lawyers or whatever. And I sit there and I'm like, wow, yeah, you're so competent and your whole life you've been able to fix and fix and fix problems. And it makes sense why you're so frustrated because you're throwing money at it and it's not fixing it. You're supporting your loved one with logic and trying to like help them reframe some of their cognitions and it's not working. And that's so frustrating. And that's such a common experience for the loved one that is so capable.
Absolutely. Yeah. Because it starts to feel like I must be failing as a father. Did I make a mistake? Am I not doing this properly? Because oftentimes parents believe until my grown adult children are out of the woods and doing really well, my job's not done.
Yeah.
And so often we just start trying harder.
And harder and harder and harder until I've pushed the addicted loved one away and until I'm burnt out.
That's right.
Joel, as we get to the last segment, I want to introduce the conversation today about research. On the podcast, we always talk about some kind of media article or research related to addiction. Today, we've selected the Rat Park study. So there's quite a famous study that was done by a bunch of researchers, Alexander, Combs, and Hathaway from 1978. We talk about this a lot in society and in the world of addiction. This is the famous Rat Park study. Joel, do you want to introduce the Rat Park study?
Yeah, it was a pretty fantastic study where you're looking at rats in cages that they had the option of, I think it was like water and I'm not sure if they used opium, right? Or if it was hydromorphone or what kind of like what they were using, but it was an opiate.
Yeah, some kind of opiate.
And they found that a lot of the rats were bang, 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 going for the drug, going for that sensation. And so over time, it's kind of like, well, wait a second, doesn't look like these rats have other options. Like, what else would they do for fun? What else would they do to alleviate the stress, the anxiety of being in this small cage? So they developed this beautiful rat park, which would be like a utopia for rats.
With their family members and
lots of other rats available.
Stimulation.
They could chase each other around. They could wrestle. They could, procreate. They could like play on mazes and toys and obstacle courses. And so what they found then is that the majority of the rats slowly stopped using the opiates because they had enough going on to kind of satiate those pleasure centers and connection and enjoyment of life that it was no longer needed for them. And so they stopped choosing it. But what the most interesting...
Did everyone though, Joel?
Yeah. And I think
every rat?
Yeah, is that there was still a small, significant number of rats that regardless of the improved environment still kept choosing the opiates. And so those are the people that we often get into treatment. So that's the one part that I think is a struggle sometimes for the average public, is that they like to believe the first part of the study or studies like it, even when a lot of the Vietnam vets were coming back from Vietnam while they were over there, and those tours were quite long. And so a lot of them got dependent and using and appeared to be addicted to heroin or opium products over there. And then what they found is that a good majority of them, when they got back and were in their home country and were engaged with family again and connection and meaning and purpose and moving things around, is that a good chunk of them just spontaneously stopped, were able to or wean off or get off or desired to be off of the opium or heroin. But again, a small but significant percentage, no matter how much the environment improved, continued to push that button. And so that's the segment of the population that ends up coming to treatment. And that's why it's so frustrating, I think, to family members or the medical community is, well, how come fixing the environment wasn't enough? How come processing the trauma wasn't enough? How come fixing all these other things and giving them love and care and opportunity wasn't enough? Because those brains are working a little differently. There's something going on, and I don't think scientists truly understand all of it yet. But what we know is that there needs to be a lot more support, a lot more understanding. It's not just a linear process. Often people cycle through with the struggles and they have some improvements and then they crash. They have some improvements and they crash. That can be devastating and hard for families or loved ones to support someone through that process because you just want them to be better. And we believe that we've provided everything we can to make it better. But then at that time, we're not really fully understanding how the brain of that percentage of people actually works.
I was excited for us to talk about this because I've seen this over the years. Socially, this rat park study has become quite well known and it becomes a point of reference. It falls in line with some of the things maybe Gabor Mate is talking about too. Like we just need to give that person like a loving environment. We need to lift them out of their, where they're living isn't so nice. We need to surround them with friends. You need to get a girlfriend. Like you need to get a job. You need stimulation.
Yeah. And
Yeah,
all of those things are true. And I think that Gabor Mate has done some beautiful and amazing work. And anybody who's working in those entrenched communities, absolutely
yeah,
fantastic. Because when you change that environment, when you change those opportunities, when you give all those things that we just talked about, it probably helps most of them, which means if you've got 100 people that are drowning and you can get 80 out of the pool,
great.
beautiful.
Yeah, and it's a prerequisite, right? Like it's a prerequisite to recovery to have a maybe more stable, supportive, stimulating
Absolutely.
environment.
And it's,
And it's I guess the argument is that that's for those 10% of rats that kept using the opioids or the 10% of soldiers that returned home and kept using their substances, like the stable protective environment isn't enough. And is
well,
that
it's
where we go to John Kelly's
still,
recommendations?
yeah, it's still necessary. Um, we don't want to lose sight of that all of those things are still true for everyone. It just, there's a percentage of them where that's not enough. And those are those pieces. And I think like John F. Kelly found that it's part of that is you desperately need to learn the coping skills for stress and anxiety, which takes a lot of practice.
Cravings,
Yeah.
right?
And then being in a protective environment where your triggers don't end up disastrous and where those cravings don't end up with you, back in a puddle somewhere or.
So I have them here. John Kelly talks about so a Harvard researcher did a big study to look at a bunch of different pieces of knowledge in the research community and synthesized it to suggest that beyond the like stimulating environment, like the rat park talks about, his four key pillars for recovery are a recovery supportive social network. So people who are supporting the person's recovery and sobriety. He suggests this is the strongest predictor of long-term abstinence.
Yeah,
Those
and I think
people.
and that's a struggle sometimes today. I mean, because I think we know that like the 12-step communities have been around for a long time and have shown that engaging in 12-step groups and community and connection addresses that one thing that John Kelly's talking about very well. But that's
Yeah.
not for everyone. And so
And smart recovery is an option in there, like religion connecting into a church.
recovery, maybe there's church groups, maybe there's other types of science-based kind of things as long.
Man, in my like, I did a bit of like, yeah, okay, you have like the AA and you have the smart and the church. I was like, sports groups, like that's part of it too, right? And
Yeah,
who we not just we play sports with, but
as
we
long
become
as the
friends.
people that you're hanging out with understand how your brain works different than most and can support you with that. And probably having other people that are a little further along in the same journey as you
Yeah.
is really important because then you don't feel so alone.
The other thing he talks about is motivation and commitment. That makes sense. There needs to be a motivation to stay sober.
Yeah, and I think often that comes from establishing goals and desired outcomes. It could be about family, it could be about career. A lot of patients talk about it as being, I want peace of mind. I want clarity of thinking. I want to have increased self-esteem. And as long as you hold those as truly valuable, then you're willing to go through life's individual discomforts, knowing that that is still attainable, something that you don't want to give up on.
Yeah. That's the like the purpose stuff, right? Jobs, family, school, like a purpose-driven life supports that motivation.
Absolutely. And giving
That's
back. He talks too about like being able to give back, like getting outside of yourself, because when we're trying to heal, we can often inadvertently become self-centered. And so sometimes we need to kind of get out of ourselves and go support and help somebody else who's maybe earlier in their journey or struggling in a different way. Being able to go and see like, yeah, that was me, or that's where I could have ended up, or I just want to be of service to somebody else to get outside of my own stuff.
makes sense. Joel, great conversation. Thank you for joining the Familywood Podcast. We're going to have some links to the center on the podcast. We'll have also a link to the original Rat Park study, which was really, really hard to find. So for any clinician or person who's referencing the Rat Park study, we have the link to actually go to the original text. I think that's important for us if we're going to be referencing it.
Nice.
And
Can you put the link, John F. Kelly book
I
as
could put the
well?
John F. Kelly link in there too. Yeah.
Good.
Yeah.
Good.
Good call. Thanks for joining us, Joel. Thanks for joining everyone. And hope you have a moment of joy today.
Good on.